Happy holidays, everybody. Welcome to the Maximize Your Medicare Weekly. You can see I've tried to make some improvements. Better focus, better lighting, hopefully. Yeah, plastic surgery is still probably necessary, but I don't think my health insurance is going to cover it. All right. Anyway, on we go. For those of you who are living under a rock and not up on current events, there are now two vaccines that have been approved against coronavirus. Now, before we get started on, my comments on the two websites, or actually the two articles that appear that explain kind of what you should be entitled to, let's talk about what this segment isn't about first. I'm not here to settle whether or not you should take the vaccine. I don't have a vote at your house. I don't want a vote at your house. I don't have an opinion about whether or not the side effects or possible allergic reactions or the safety, etc., etc. I'm not a medical expert at all, right? I don't pretend to be. So what I'm going to be talking about, however, is how to think about the cost and how your health insurance or lack of health insurance should be interacting with the availability of the coronavirus vaccine. Oh my God. This is like the third take of this segment. And each of the prior two takes were either a technology problem and the other one lasted 90 minutes. Ugh. All right. I want to take a look at the incoming Biden administration. For those of you who don't believe that Joe Biden is the president-elect, please, I'll just save you the time. Just hit stop right here. Okay. I'm not going to address false narratives. What Biden's election means for U.S. healthcare and public health, etc., etc. I'm going to breeze by the things other than to point out just observations that I've had. And it happens all the time, which is why I am this exhausted all the time when I read, things from the media. And my bottom line here is distortion is not the monopoly of any party. Okay? I don't care what the issue is. When it comes to healthcare and health insurance, the distortions are, is an equal opportunity, playing field. Right? And no matter what side you take, and it can be more than two, right? Any opinion those persons stretched, it all of a sudden then becomes distorted. And then the falsehoods start flowing in. The incorrect, the incorrect implications of everything, start to come in. Okay? And so now here we go. And let's just start right here. You've got blah, blah, blah. The Trump administration has done this horrible stuff, scaled back federal investment, giving states more authority to run their health insurance markets. Yeah, this all looks negative, right? I think that we can agree this is not like some kind of compliment. What is left out? Here's your perfect example. What's left out here is that the states then improved the quality of coverage to their citizens when they had control. That's a pretty big omission, don't you think? Yeah. And it just goes to show you, like, okay, well, I'm going to leave out, I'm going to put in some kind of, sweeping generalization without leaving some other, additional, minor details. Oh, yeah, well, the minor detail increased the window to enroll. And, oh, yeah, in Colorado, for example, they put a cap on insulin costs for everyone, not only those who are 65 and older, according to federal Medicare rules. You see what I'm saying? In other words, I'm not thinking that this person is uneducated or unqualified to be a part of the media. No. You could hear my other segments, right? I just don't believe that. I don't believe that in our country of 320 million. Just don't. Right? There's a smart person. The omission, the only possible explanation is the omission here is intentional. It's a fact. Let's just continue. So now we've got blah, 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 and the Affordable Care Act. So I've already spoken about the Affordable Care Act and the Supreme Court. I've already done this in a prior edition of the weekly. And there basically what I said is two things. I'm going to, cut through this article basically. Number one, I don't think that the Supreme Court is going to cut this down. And I'm not a Supreme Court watcher. I'm not a constitutional lawyer. So those are my caveats to begin. But the fact of the matter is that the Supreme Court justice, when they asked the lawyers who were arguing the case, they basically asked them, why are you here? We already told you that this is a legislative matter. So now you're back here trying to have us judge again for something that you legislators didn't even bother to try to strike down. Why are you back here? That's basically, literally, that's basically what Supreme Court, your Chief Justice Robert asked. I don't know. Without being a Supreme Court watcher, that doesn't sound like very, very good for those people trying to argue to strike this thing down. Let's say I'm wrong. Let's say out of the blue, okay, they kind of agreed and they decided to strike it down. I just told you that states have the right to override. And by override, what I mean is that CMS creates a federal set. States, however, control insurance markets. That's how Colorado, Minnesota, Massachusetts, New York, they have additional rights on top of the federal standard. This is entirely allowable. We're not going to get into problem in the political science theory and of federalism, et cetera, and states power, et cetera, et cetera. Okay, we're not going to ever settle. Well, we're not going to settle that on this, platform. But the point here is that even if the Affordable Care Act were struck down, the states could then continue to say, okay, we've got extra leeway. So that's number one. The second problem here is just the practical reality if you think about the way that a health insurance company works. Okay, so now we're going to have this court decision sometime in spring. Okay, so now let's call it April 1st, April 2nd. I don't want to call it April Fool's Day, so let's call it April 2nd, right? And then now you all of a sudden, you get this, a very unexpected verdict, which I do not think is going to occur, but let's say it does. Right, let's say all of a sudden that the court strikes down the Affordable Care Act. Okay, in doing so, what would happen? So it's now April 2nd. 3 months have passed, 9 months to go. What does a health insurance company have to do? Health insurance company has to figure out its rates, has to then get them approved by the state, and then enact them. It's now it's now April 1. How are you going to actually be able to do this? Let's say, for example, the Affordable Care Act strikes down the idea of pre-existing conditions clause, which is what the alarmists would have you believe. The alarmists here are going to say, okay, well, you strike down the Affordable Care Act, everyone's going, the people with pre-existing conditions are going to be eliminated. They're going to have no health insurance. It's going to be right here, right? Here's the sentence. Would have to work to come up with the possibility of tens of millions of people becoming uninsured. Really? So the health insurance companies get their recalculated numbers, going to have to approach the states and have them all approved. How long is that going to? They plan this. This takes months for them to file, and then what normally happens every year is you file some numbers with the state, and and then the two bicker back and forth, et cetera, and the company says, "Here's our math, and see how it works," and the state goes, "Yeah, no," and this whole process. So now how long is this going to take? So now we're through mid-year. Do you see what I'm saying? This isn't practical. So what I mean by this isn't practical is this outcome, the possibility of tens of millions of people becoming uninsured amid a pandemic, that to me just strikes me as totally impractical. The insurance companies can't administer it, and the Supreme Court has already tipped its hand. Instead, what this is a message to say, that guy over there is trying to take away your health insurance amid a pandemic. I just don't see it. Let's continue on, however, with other planks of the Biden, health insurance platform. Number one is a public option. This is the one. This is the one. Everything tells me here that this will get a position in the public debate. It will. Kamala Harris, the vice president-elect, is from California. She ran on the public option. The incoming secretary to the Department of Health and Human Services, which governs the CMS, which is the Center for Medicare and Medicaid Services, okay, also from California. Followers, listeners, radio interviews around the country, during the Democratic nomination process. I was guest on a number of radio stations around the country speaking about what a public option would look like. Basically, what would happen is the government would have a backstop. It would create a program that itself would run. I can certainly see that an effort being made along those lines. Now, the drawback to it is the logical, likely opposition to a public option by stakeholders who are huge and important. And who are they? Doctors and hospitals. Because what will happen is the leverage, this is correct, the leverage the government would have to drive down the prices of doctors' visits and hospital care. This is Larry Levitt. This is not your average person. This is not your average person. If there's a single person that I listen to on health policy matters in the nation, this is my person. Okay? Singular person that I would pick if I had to listen to only one voice about the perspective. Now, do we agree on everything? No, we definitely do not agree when it comes to the use of the word junk insurance when it comes to short-term health insurance. I absolutely do not agree with that. You can see other videos where I've discussed this. Here, however, so that is, my compliments to this person and to the Kaiser Family Foundation. Okay. I didn't want you to think that I was just sitting here just like throwing spitballs at every other party on the planet. The leverage the government would have to drive it. Now, yes. So what does that also mean? Now you can see who's going to object. Doctors and hospitals. These are not unimportant parties here. Think we can agree on that. And the problem we're not going to solve here is actually a much, much bigger one, which is the issue is that the cost of healthcare itself is too high in the United States. Health insurance is the calculated result of the cost of healthcare. This is why Jay is such a pain in the neck about distinguishing health care versus health insurance. Okay? And the analogy I like to draw is simple. These are raw oranges, and this is orange juice. For someone to say that I'm going to determine the cost of oranges based on the grocery store price of a half a gallon of Tropicana. Okay, so Tropicana costs, $6 for a half a gallon. That determines how much a dozen oranges cost? No, it isn't. That's the wrong way around. Right? It's cold in Florida. Oranges all die. Oranges are now $75 a dozen. Guess what's going to happen to the half a gallon of Tropicana? It's going higher. It's not the other way around. Oh, Tropicana costs $6 a half a gallon. Therefore, oranges are $2 a dozen. No. That's backwards. The problem that we've got right here is we're addressing health insurance as kind of as if that's going to solve the cost of health care. Guess what? If you drive down your premium of your individual health insurance plan down by 20%, your doctor still has $300,000 of educational debt. You're not getting away from that. And oh yeah, by the way, we're not going to go down the wormhole of, well, they're going to make it back, etc., this, that, and the other. Just think to yourself, your grandchild wants to be medical doctor. That's what they say. Guess what your answer should be? No. Your answer should be no. Absolutely not. Bad idea. You're looking at minus $500,000 of tuition with no food, no place to sleep, not a single beer. We haven't bought a book. Oh yeah, and by the way, when you get out, and you're not going to get any money back until you're 35 at the minimum, right? And the federal government is going to be your payer of your salary. No, thank you. Bad idea. By the way, I've actually made this statement in front of people, and you know what ended up happening is that hospitals, that people who attended my public presentation from the hospitals came and who actually knew me, from the past said, "Please don't say this in public. We need more doctors." Doesn't make sense. Anyway, on we go. We're not going to solve this until you solve. My point here is you're not going to solve this until you strip this down to the struts. All the way down to the struts. So all this stuff, when we're trying to fix health insurance and the health insurance market and access and all these tweaks, etc., as if that's going to drive down the price of healthcare. No. They're trying to fix the mechanics of the price of a half a gallon of Tropicana as the mechanism to fix the open market price of a dozen oranges. Wrong way around. All right. I'm off my soapbox. We'll go on. This is about COVID. We're going to skip through that because I already discussed it. Last plank here, Medicare. This one here is a possible possible proposal, which is that he would like to allow people to enroll as early as age 60. So, full disclosure, right? Authors of books on Medicare would welcome this for obvious reasons, right? Because that basically means, well, 10,000 people a day times 365 days times 5 years. That's about 3.65 times 5, 18 million, 18.25 million people. So that means possibly 18.25 million extra buyers of a market for a book on Medicare, available on Amazon.com. Let's not get crazy, right? There are 62 million of you that are, already enrolled in Medicare. None of you understand it, and all 62 million don't own my book. So it's not like I'm going to sell 18 million books. So, but my question, rhetorical question here is, how are you going to pay? You have a Medicare trust account at the federal government. What's it called? Yeah, I slip of the tongue, but there is a Medicare trust fund. There you go, Medicare trust fund for Part A. Right, it comes from your tax withholdings. Right, all of a sudden, blip, 18.25 million extra enrollees, all drawing from Part A, the same fund. It's not clear to me. Maybe I've just not seen it. I'm sure it's somewhere. We'll delve into that in the future. In addition to that, there's Part B over here, right? That comes from the general federal deficit. For those of you who are not up on current events about the status of our national ledger, it is minus. It's minus, right? Adding 18 extra million people onto Medicare, that's not going to make it better, okay? Without taxes. Without taxes. Okay. So I've cut it down. I'll expand, I'm sure, on all of these points as we go. I'm quite sure that will happen. It's early doors. We'll have to see, but I want to give people a preview on what is coming up starting in January when the president-elect takes office. We've run out of time. Let's stop it here for today. Be sure to go to the website for the book, maximizeyourmedicare.com. You'll see this up there. Lots of resources up there, videos, as well as way to enroll. I don't really make too much of it. Most of the time I'm spending giving information. Up to the point of giving you the information is one thing. It is not the complete deal. Meaning that, crossing the finish line in the correct way is important. It's actually more sensitive than many people realize. And when you make a mistake, it's hard to unwind. It's hard to understand what all the implications are. You can contact me, emails, etc., and through that website, maximizeyourmedicare.com. Your first, inquiry is always free. I get back within 24 hours, and from there, can begin the conversation. That's it for now. Happy holidays. I'm going to take us out here by, please go to TikTok. I have now crazily entered into that world to a limited degree, and we'll speak with you next time. Thanks for watching. Oh, wait. Like and subscribe to the channel. Be sure to hit that bell because it'll tell you when new videos have been posted. Speak with you next time.